Et l'on part tout cela tout de suite pour d'abord pour
So
Singapour.
we will now travel to Singapore with Edouard Bouty, who's the founder and executive CEO of Reach 52. So we really have international people. So thank you, Edouard. What time is it in Singapore and what's the weather like?
Yeah, thank you very much, and very much ashamed that we can't all be together today. But yeah, hello from Singapore. It is 5:30 p.m. here today, and I actually can't see what the weather's like. I assume hot. It's always very, very hot here.
Merci pour
Thank you, Edouard. You are English, British. You are now living in Singapore. You have developed Reach 52 for the most remote populations from hospitals. So you are the first nominee award winner of the e-health. So how does this project work? Let's discover this in video.
en images.
% of our world cannot access healthcare. That is 3.7 billion people that need access to essential healthcare, and we look to build low-cost digital models to serve them. We train women in rural communities, we give them a phone and we give them a salary. Through our training, they can become like a health worker. So it's a community-owned, community-run network of women in villages that provide essential health support. So when we launch in community, our network of women access managers on the ground go door to door and collect data from every resident in the village. Based on this data, we work with the government and we design outreach programs from door-to-door events, to group events, to rural clinics, to connect local villages to the care that they need. So for us, success is about connecting people to essential health services from both government and private sector. We want to create a sustainable model where we really work with government to support them. So when we receive the prize, we will continue to invest in our technology. We've already built a robust platform to support community members, and we want to enhance this further, growing our users and growing the amount of services that we can offer in these disconnected areas where traditional health services don't reach.
So, Reach 52, warm applause to this project. So, Edouard Bouty, are you here with us? So, first question, and maybe it's in the project that you have presented to create a closer bridge. So, why did you involve women in the project?
Yeah, that's a really great question, and yeah, hope you enjoyed that video as well. And again, thanks for the ODESS team and everybody involved for helping us pull that together. Yeah, going back, I mean, yeah, to the start of Reach 52, we, as mentioned, we look to really connect rural, underserved communities to healthcare. We work in about 1,000 communities across the Philippines, Cambodia, and India. And the first idea actually was just purely an app, you know, just the tech for people to access healthcare. So we were going to these rural villages. We were actually getting a 10-inch Android tablet and putting it in a common place, you know, by the church or in the center of a village, and just expecting people to be able to access healthcare using a technology platform available in a shared location in their, you know, rural area, and then they could order their medicines and speak to a doctor through that. And yeah, very, very openly, that didn't work really. People just weren't self-serving. They weren't necessarily, you know, well educated about what healthcare they needed, and that's where we evolved our model. So we started finding out the local people that were actually trusted for healthcare advice and where people, in the absence of doctors, often went to for healthcare advice. And we empowered them and we changed our model a bit. So why women? yeah, often just because they are the source of healthcare information and support where there's low to no doctors. They're often trusted by communities. They often don't fit into the local labour economy because a lot of the communities we work in are farming and fishing, which tends to be male-dominated industries. And, you know, it's just great for us because we've created 400 jobs this year. So we create employment, also, you know, leverage these trust networks and, yeah, really allows us to deliver an impactful service.
Because they are not real doctors, they're not nurses, they don't have any education, is that a barrier for you, for your application?
Yeah, yeah, it's a valid point, and just to be very clear, yeah, we do not replace doctors or nurses with these women that we hire and train. You can sort of think of them as coordinators, village level coordinators. So imagine you're in a village, you know, 3 hours away from a hospital. We train 1 or 2 women in your village. They might go to your house and ask you about your healthcare needs. You know, really collecting data and so on. And then we're working with the government primary care provider, so with the government, with the doctors, with the nurses. And based on that data, we organise a range of programs. So that can be diabetes screening events, or it can be rural clinics, or we've done work in hepatitis and HIV screening. And what would happen there is the government would go and run a one-off clinic in the community. So they'd be bringing a nurse, doing the screening and stuff. And the people in your village would just be knocking on your door. They'd be getting you out of the house. They'd be making sure you're in the right place at the right time. And then obviously also ordering the medicine that you might need, delivering that back, helping you order discounted insurance as well. So I guess they're really more sort of facilitators or navigators of care in the community. And they really just look to work in partnership with the government healthcare providers to bring them to the community and then play a facilitating role in you know, making sure that community is in the right place at the right time, I guess.
Edouard, you were saying that you were working with the governments hand in hand. Can you tell us very briefly what you do? What is your business model, in other words? What is the economic model, if you like? Do you have something specific for you, for your project? Are you paid for all your action?
Yeah, it's a really great question, and we're, you know, fully transparent about how we make money. So I guess to the first part of the question, yes, 100% government are fully involved in every country. We have formal memorandums of understanding in terms of our work with government, and, you know, if there's a government service available, we always use that first and really look to bring existing government services that are often in, you know, the middle of the town. We just look to work in the villages around the town and really help decentralize and bring, yeah, government services to those communities. But obviously, just through this network of women, we're also ordering discounted medicines and insurance plans from private sector partners. So in most of our sites, there's very little government coverage, and therefore we have to work with private sector to bring in more affordable medicines and stuff to the village because the government simply doesn't provide it. So in terms of our business model, partly it's grants. So we do get grants. We have received a number of grants this year from donors and large private foundations, and of course ODESS and so on. I'm very grateful for that. But then secondly, we also do sell discounted medicine, and we make a small delivery fee on that. So often the travel to the nearest town might be $4 or $5 for the bus. We charge about a $1 delivery fee, and we bring discounted medicine to the village. And that gives us a small revenue channel as well that allows us to pay the women and keep the model sustainable.
One last question, Edouard. You have developed also this application to fight against epidemics. And COVID is what we're talking about right now. How about hepatitis B also? Can you tell us a little how you've adapted your application to these two problems?
Yeah, it's a really valid point. So yeah, if you think about our core technology, we can collect data on healthcare needs, run these health events, sign up attendees, book appointments with local facilities, do public health campaigns and manage one-on-one interventions, order medicines and scan prescriptions, order insurance, deliver medicines. So really sort of spanning the whole patient journey. To integrate the patients, though, or the citizens, we use a lot of Messenger. So say it's reordering your medicine, you might do that via Facebook Messenger or via SMS, because people tend to use those applications anyway. So I might be your health worker. I invite you to the event, you get a screening from the government, you order medicine from me, you pay me as your health worker, I then deliver it to you. Then the next month you get an SMS or a WhatsApp message or whatever. Do you want to reorder? Yes. And then that places an order in our system. And then I would just get the order as the health worker and come and deliver again. So yeah, with COVID, of course, hugely problematic. We've been doing a huge amount, firstly on letting NGOs use our apps. So we've started working with 6 NGOs in our core countries to help them give access to more products and services. And then given that we do a lot with Facebook Messenger and WhatsApp, we built COVID symptom checkers and where to get information and where to get support within Facebook Messenger. And then we ran Facebook ads that were paid for by Facebook to promote this. So, if you're worried about COVID, you see an ad on Facebook, click the link, Facebook Messenger pops up, and then you can really just chat. It just feels like you're chatting to a normal person, but it's actually technology that's replying and it's just automated. And then we were giving COVID advice, managing referrals, checking symptoms, all through social media effectively. And we've scaled that to about 1 million people now, funded by a grant from a major global organization, as well as using it to support health workers as well. So we were actually giving this tool to frontline health workers. So as they were finding patients, they could also know what to do and get advice, but really using social media, because of course that can still get into communities where often physical movement is quite limited given the lockdowns.
Merci beaucoup, Edouard, pour cette.
Thank you so much, Edouard. Thank you for all this information. And we can see through your Reach 52, you have challenges, of course, but now we have more information given to the remote population, but also data collection for each patient, analysis of data. But on top of this, you have a valuable brick, that is to say, social networks. Now, these are GAFAs, but this is maybe a good way of keeping in touch with populations, because you talked about Facebook, how GAFA can really help us. Thank you so much, Edward. Warm applause for this wonderful project. Congratulations, Edward, for this award. Stay with us. I'm sure that we will have a lot of comments, questions on Reach 52. Don't hesitate. We already have a lot of questions coming through our chat. One quick hello to from Bloomshire, who is working on the eHealth network, and says also congratulations to all the award winners. Reach 52, thank you, and hello from Thailand. Jai also, who is also correspondent in Cayenne, also in Asia. A quick hello, Jan. Sorry, he's in India, and he's saying congratulations for this wonderful meeting. Now we will switch from Asia to Africa and meet our second award winner and nominee. We're going to Togo, Lomé. We will have Rodrigue Kafui Koffi Akolly. So hello, Rodrigue, can you hear us from Togo? So please switch on your mic, because we cannot hear you. We can see you, but we cannot hear you.
Ça y est, le son nous arrive. Bonjour Rodrigue, est-ce que vous nous entendez?
Hello, Rodrigue, can you hear us? In Loma, it is 9 o'clock. And do you have sunshine? Do you have heat? Is it warm and sunny? Yes, we do. So thank you. Send us some sunshine. You are the executive manager of eCentre Convivial. All the questions around sex. So how does it work on eCentre Convivial? We'll have a small video.
Les jeunes préfèrent s'adresser aux téléconseillers en ligne.
Hello, this is an application which is 100% confidential, anonymous, and it's an opportunity to get information on sexual health.
Les principales actions menées par
The main action that we do is to work with schools and also manage sexually transmitted diseases. And we also have to scale the eCentre Convivial with the new technologies. We also have a wider technical plateau. We work with a lot of people that are going to help these young and answer their questions.
Voilà, le e-centre convivial.
Okay, the e-centre convivial in Lomé, second award winner of this year, this 2020 prize. We are very digital for young people. It's easier for them to get information via app, through a phone or a computer. Now, why? You are available 7 days a week, 24 hours a day. You can ask your question at any time. Is it because you have a generation that are very impatient? They need to have the information not right now? Now, this subject, and in Togo, it's very difficult to have appointments or information to inform. So unfortunately, even in schools, they don't have the right information. It's difficult. So what we want to do is to make sure that we can give them some information. It's a concern by young people, but also pregnant women. We have decided to have an app and to make sure that this app gives information anytime, anywhere. And we wanted to follow the internet wave. Yes, it's important, and we have heard this a lot this morning, bringing the right information, the proper information, adapted information. On internet, we find things that are not necessarily true. Is that the case, information? Yes, we want to give reliable information. Health professionals give that information. And so people who go on the application, they know that they're going to get reliable information from a health professional. They want to find information on specific topics. You are managing an e-centre convivial, so the other actions of this e-centre is digital, and also attracting young population, but you also have a physical brick-and-mortar centers where you have nurses and doctors. Is that the case? Yes, this is one application. But there's also the possibility of having online consultations. And we still want to welcome people in a center. So, you know, sometimes we need to welcome these people. They want confidentiality. And we want to make sure that we ensure this confidentiality by having centers. And again, the information has to be safe. And the service provider is here to really work with these patients, and patients feel safe. The idea is to be as close as possible to the patients. So then we have a follow-up, and then we also give training. The idea is to have high-quality medical service. Again, when we call the eCentre Convivial, we know that the data is going to be protected. And it's safe for the user and the service provider. Togo also had a COVID epidemics. You had some curfew imposed. And so, of course, people had to use digital tools. Did this have consequences on the questions that were asked to your eCentre? What kind of messages? People were afraid? People were concerned? What happened during that curfew period? Now, when we first knew about the COVID case, we have decided again to have curfew. So eCentre Convivial was perfectly adapted to this situation. Because overall you had now e-health consultations. And that was necessary, especially if people stayed at home. So we decided to increase the number of online consultations. So we also had to train the doctors. We also had to communicate to the population. We had to inform the population about what we could do. And also two environments, we had to adapt ourselves to technology. We did not feel that it was difficult. We didn't see more people, more concern. Obviously, they were able to use the application and they felt reassured. Thank you so much. So this is very useful, especially during lockdown. Very quickly, Rodrigue, do you think that this e-santé, e-centre convivial, can it be duplicated? Or it's so specific to Togo? Can you duplicate this? Is it a model that everyone can have? Yes, we believe that it's can be duplicated. The idea is to keep a social link and also keep a link with the population, whether it's in Togo or in another country. Again, the population has to accept. And today, eCentre Convivial is part of the tech solutions for health. So today, we're already thinking of expanding and duplicating what we did. Maybe in other countries, regardless of the situation. Well, thank you, congratulations, and this is you deserve a warm applause for your action. So again, 24 hours a day, 7 days a week, young people in Togo can ask questions through eCentre Convivial. So I'm sure we will have questions from the room or also the chat. So a first question for Edward, if you're still with us. Edward, does your application also covers mother and baby health? That's a question for Edward.
Oh, sorry, I was just coming off mute. Do we cover mother and baby health? Yes. I mean, we tend to focus on three main healthcare areas. We've maternal and child health has certainly been one of them. We had a couple of slides for this presentation, and that was really actually looking at what we've done in this space. We've done a lot of scans and screening for pregnant mothers. We've done vitamin distribution. We've done antenatal and prenatal care checking with midwives. We're currently doing a program with Philips on ultrasounds for pregnant mothers in rural areas. So yeah, it's one of our top three focus areas. We've also worked in infectious disease, specifically hepatitis and HIV, as well as non-communicable diseases like diabetes and hypertension as well. But yeah, maternal and child health has been a top one for us, and where we've seen a huge amount of progress as well. Thanks for the question.
Merci, Edouard.
Thank you for your answer. I'm looking to see if in the room we have people who want to ask questions. If yes, we'll give the person the mic. So do not touch the mic. Sorry, someone will keep it for you. I have a question. Listening to all these projects, very interesting. Thank you. We provide information, and in Togo said that I'm bringing real information, reliable information, and I find that one current problem that we have is fake news. The scientific articles up to now were published and discussed by experts. But there was what we call a retention of information, and that posed a problem. Now, with sorry, there was a problem with the sound. So we decided to publish on what we call pre-publication platform, so that information was quick, but it's not a validated information. So therefore, you have a risk. You have people who are not necessarily doctors that are going to disseminate this information. As a result, you have a lack of reliability, and people don't trust experts anymore. So how do you orchestrate all that? That's the question. Thank you. I will maybe ask Rodrigue, because they answer questions from young people with reliable information. So basically, where do you get this information? How do you train also your workers to make sure that they give reliable information and not fake news? We have a partnership with the government and the Ministry of Health. They also give us information, and they train us. It's not information that we get from social network. So this is reliable, validated information that we get. And there's a specific medical team in Togo working on that. So it's a coordination that we have, and that's how we communicate. So we know that the information is safe. It's updated on a day-to-day basis. So right from the beginning, these are doctors, nurses, health professionals that give the information, and then they train also other caregivers, making sure that the information that is given is reliable. So again, we don't want to be a victim of fake news. We don't want, but it's true, people call us and say, we heard this. Okay, so training of trainers or trainers of training. So this is really important. Thank you, Rodrigue. Thank you, both of you, Edouard and Rodrigue. So congratulations to our first two award winners.